Health Minister Dr. Zweli Mkhize confirmed that South Africa is expediting the COVID-19 vaccine for health workers. The country will receive 1 million AstraZeneca doses this month and 500,000 in February. Trade unions previously slammed the delayed rollout of the jabs for frontline workers. Now, for reaction on this, I'm joined by Zola Sepeta, NEHAWU's General Secretary. A few days ago when we spoke, Zola, you had many things to say to government. So clearly, this must be some welcome relief.
Good news indeed. We'd already spoken with the Minister and the DG, and we are looking forward to see each other so that we can discuss the rollout program, which will be inclusive of our views. We're quite happy with that.
Now, do you think government came under pressure to speed up this process?
Of course, pressure needed to come in all corners. No one can take credit about it, including the efforts put by government, but there has been a serious pressure which has helped to speed up the negotiations. Hence today, we received an announcement that by January we might get 1.2 doses to help frontline workers, and then in February 500,000. And we are aware that it's not only those, there are discussions that are underway now. So probably we might hear some good news as well in addition to this one while rolling out the plan.
Well, logistics obviously becomes an issue because the AstraZeneca requires 2 vaccine doses. How do you see that happening?
Look, we are to get into a meeting. Remember, this thing was made as in a form of an announcement. So in an announcement, there will be no details. So in that meeting that we are preparing, we'll get details and see how we also think this should be looked into as part of rolling out. Look, we need anything that will come and help us. The increase in numbers and both in terms of infections and death are really alarming. So we need anything that can help us to save the nation.
Now, what is the message coming from your membership? They must be pretty excited about this development.
Certainly, because one thing that this announcement has made, it has dealt with an anxiety that is out there. Given particularly the yesterday statistics, which is too scary. And with this vaccine and the announcement, it gives hope. So that's what members have for now is hope, but the practical and the details ought to be get into when we meet so that the plan is quite clear and is known by everyone before its implementation.
Now, there are 2 schools of thought. One obviously is take the vaccine, and there are others that are reluctant to take the vaccine. Do you encourage your members to take the vaccine? Are there any concerns?
In the absence of any other thing, remember, this is not imposed. It's a choice that the person ought to take. But it will be helpful because it's useless to live in theory. We will have to practice this in order to check whether it's working or not. And unfortunately, it's not going to be tested in animals. It ought to be tested in human beings. That's an unfortunate part of it. But anything that helps and saves the lives of our members will risk and consider it.
Zola Sepeta, thank you so much for speaking to us this afternoon. NEHAWU General Secretary, giving us excitement at the planned jabs that will be coming into effect during the course of next month.